My name is Amol Nirgadkar. I'm the CEO of Patient Prism, and I'm here with Ryan Vet, who is an expert dental consultant who advises practices all across the country on branding and marketing. And Ryan's worked with some of the largest companies and brands we know, like Warner Brothers and Samsung and Bing. And really now his mission is to really help dental practices create experiences worth sharing and inspire positive change in behavior. Great mission. We love that mission. We embrace that mission at Patient Prism. In this particular segment, I want to talk to you about marketing budgets, because it's front line of like how much do I need to spend to attract patients into a practice. So what are your thoughts on that?
That's a big question, and it varies from practice to practice, but we can talk about some of the markers that you need to know to determine your budget. First of all, it's really what do you want to get out of what you spend. And the most important thing that a lot of dental practices don't think about is for every dollar I put in, how many dollars are coming out on the backside. So for every dollar I put in, it's just your ROI. If I put in $1, am I getting $5 of production out of it? Am I getting $10 of production out of it?
Sure.
And that's the first marker that you need to identify. And from there you can build a foundation of what marketing tactics you're going to use. So first you need to know, what do you want to get out of it, then how much does it cost to invest to get that result, and then what tactics do you use. So some people prefer their local magazine, their city magazine. Some people prefer the park bench or the billboard. I would recommend going more digital because it's so much easier to track. You can link directly to phone calls, and you can track all the way down to the dollar amount of that phone call and how that was scheduled. So that's a better way. But the question is, how do you really set that budget? I see practices that spend no more than $1,000 a month on everything. That's entirely too low. I've worked with practices that have $30,000 a month budgets that are specialists, and they do radio, and they do print, and they do digital, and they do all sorts of campaigns. So it's really trying to figure out what you want your ROI to be.
Well, we've seen consultants out there recommend anywhere between 2 to 5% you should spend on marketing, but I've seen, as long as you have an ROI, it really doesn't matter how much you spend.
Correct.
Because if you're getting that 5x, 6x, 10x ROI, then what difference does it make? As long as you have the capacity to see the patients, obviously.
Exactly.
But if you're spending 10 grand a month, oh my God, that's a lot of money. But that's a lot of money, and it's not a lot of money if you're getting 100 grand back, right?
Exactly.
And that's the mindset that sometimes I see in dentistry, where they look at the absolute number versus the relative benefit.
Exactly. And so it's this idea of diminishing returns too. There's a point at which you can't spend anymore and make more money.
That's a good point.
I would say spend up to that point. Practices never actually reach their potential in marketing because they get that sticker shock. They're like, I can't spend $10,000 a month. It's like, you can't, actually you can, and guess what's going to happen? You're going to get $100,000 in production. And it does go back to what you're saying. You have to be able to handle that capacity, because you do want to create that experience for that patient once they're in your practice. Otherwise, you're never going to see them again. So there is a trade-off.
The one thing that we notice at Patient Prism is sometimes practices will have such a low budget that it doesn't give you any traction, so all the money is wasted.
Exactly.
So what do you think about that?
So I would definitely say if you're spending under $1,000, you're underspending. Just as a rule of thumb, now every practice is different, but as a blanket statement, I would say you're not investing enough in marketing because you're not giving marketing a fair shot. The other part of it is marketing doesn't work in the first 30 days, 9 times out of 10. You have to give it 60 to 90 days to even see if it's going to work. So commit to it, say, hey, I'm going to spend $2,000 a month, and I'm going to see if it grows my practice. And if you invest $2,000 and you get $20,000 of production each month, then invest $3,000. If you get 30, invest $4,000. If you get 40, until that you get the diminishing returns.
Until you get the line starts flattening out. So it's really important, I guess, as you're figuring out what the budget should be, to really have enough of a budget. And how important is it to really split test your budget across different mediums?
100% important. You need to understand where every dollar is coming from. So if your team right now isn't asking at some point in that patient journey where that patient heard about your office, you absolutely have to ask, because let's say you're investing in billboards and it's only $800 a month for that billboard near your office, and no patient ever has seen that billboard, you're wasting $800 a month.
Absolutely.
But if you're spending $500 a month on pay-per-click ads, and everyone's coming from your pay-per-click ads, put that $800 there. Now you have $1,300, and it makes so much more sense. The other thing I do want to add is you can market inside your practice too. Inside your physical location, make sure you're investing in your actual building and what you do for patients when they come in, the little package you give them, the goodie bag when they leave. That's marketing. That's going to help them come back. And so you have to look at the lifetime value of a patient, not just the first patient appointment when they come in, but how much do they earn your practice over the course of a year, over 3 years, over 7 years?
So the marketing is not just external to get the new patients in, but also internal.
Absolutely.
To make sure that we're giving them whatever goodie bags or whatever that might to optimize the experience so they can spend more money with us.
Exactly.
Perfect.
Exactly.
Great discussion. Thank you so much.
Appreciate it.